Okay, let's unpack this deep dive. We're tackling something specific today, urinary stones, but a particular kind, in our dogs and cats.
That's right. We're diving into urate uroliths. There are different kinds of stones pets can get, but the sources you've gathered give us a really solid picture of these urate stones, what they are, why they pop up, how we find them, and maybe most importantly, how we manage and prevent them.
Exactly. Think of this as getting the essential info you need about this condition, sort of cutting through the complexity. We're here to guide you through the key takeaways from these sources.
Okay, so where do we start? What are urate uroliths?
Simply put, they're stones in the urinary tract, yeah. Made up of stuff related to uric acid, like uric acid itself, or sodium urate, ammonium urate. And the sources point out they're, a specific slice of the pie, maybe 5 to 8% of stones that actually get retrieved and analyzed. Not the most common, but definitely significant.
Right. And figuring out why they form, well, that takes us into how the body normally handles substances called purines.
Purines. Okay, so those are building blocks found in DNA and RNA, right? And also in certain foods.
Exactly, especially things like organ meats. Normally the body has a neat pathway to break these down.
And there's a key player in that pathway, an enzyme.
Yes, uricase. It's primarily a liver enzyme, and most mammals, including almost all dogs and all cats, have it. Its job is basically to take uric acid, the end product of purine breakdown, and convert it into something called allantoin.
Allantoin. Is that easier for the body to handle?
Much easier. It's very soluble, dissolves readily in water, so it just gets flushed out in the urine. No problem.
So the problem arises when that conversion falters.
Precisely. Something disrupts that smooth conversion of uric acid to allantoin. The result is too much uric acid hanging around, especially building up in the urine. That's a state we call hyperuricasuria.
Hyperuricasuria, high uric acid in the urine.
And that excess uric acid, under the right conditions, can crystallize and eventually form into stones.
Okay, so what causes that disruption? The sources mention like 2 main pathways.
Yeah, 2 primary routes lead to this hyperuricasuria.
And the first one, that's the genetic link.
Right.
Especially in dogs.
Yes, that's probably the most well-known cause, particularly for certain breeds. There's a specific gene defect. It's in the SLC2A9 gene.
SLC2A9. And what does that gene normally do?
It's involved in transporting uric acid, especially in the kidneys. In dogs with this mutation, their kidneys aren't good at pulling uric acid back out of the urine as it's being formed.
So instead of reabsorbing it into the blood,
it just gets dumped into the urine in excessive amounts. Even if their liver function and uricase are perfectly normal, their kidneys are leaking too much uric acid out.
And this is the Dalmatian connection, isn't it? This is really fascinating.
It absolutely is. Historically, all Dalmatians carried this specific genetic mutation. It's kind of baked into the breed standards history.
Well, all of them. So every Dalmatian is predisposed.
Genetically, yes. They all have the hardware, so to speak, for excreting high levels of uric acid. But, and this is a really important, but not every Dalmatian actually forms stones.
Ah, okay. So the gene mutation is necessary but not sufficient on its own.
Exactly. Other factors need to line up for stones to actually develop. The gene sets the stage, increasing the risk significantly.
Makes sense. What other breeds are on that genetic risk list? I saw quite a few mentioned.
Yeah, English Bulldogs are definitely high on the list. Also Russian Terriers, Black Russian Terriers, American Bulldogs, and then breeds like Australian Shepherds, Beagles, German Short-haired Pointers, even Labs have shown increased risk. And also breeds prone to liver shunts, which we'll get to.
Okay. And the sources also mentioned something about intact male dogs being more prone within those genetic breeds.
That's right. It seems more common in intact males. The thinking is maybe hormonal influences on kidney transport play a role, but also, frankly, anatomy.
Anatomy.
Yeah. A male dog's urethra, the tube urine leaves the body through, is much longer and narrower than a female's. So even a pretty small stone is far more likely to get stuck and cause a blockage.
Right, a blockage. We'll definitely need to talk more about that. Okay, so that's the genetic pathway, a kidney transport issue. What's the other main road to these urate stones?
That would be the acquired route, and it's usually linked to liver problems.
Liver disease.
Yeah.
And the big one mentioned is portosystemic shunts, PSS.
Exactly. A PSS, or shunt, means there are abnormal blood vessels that let blood coming from the intestines bypass the liver.
So the blood doesn't get filtered or processed properly by the liver.
Correct. And the liver is ground zero for purine metabolism and, crucially, for producing that uricase enzyme. If blood bypasses the liver can't do its job converting uric acid to allantoin effectively.
So it's a different breakdown point, not the kidney excretion, but the liver's actual processing or enzyme function.
Precisely. So you end up with high uric acid in the urine, same as the genetic form, but it's because the liver isn't handling it. And this often comes with other signs related to poor liver function, like high ammonia levels, maybe neurological signs.
And it's not just shunts, right? Severe liver failure in general could also impact this.
Yes, any severe widespread liver dysfunction could potentially compromise the liver's ability to make enough uricase or metabolize purines properly.
The sources also flagged diet. High purine foods, like organ meats. They can make things worse.
They can definitely contribute, especially in an animal that's already predisposed, either genetically or because of liver issues. It adds more raw material, more purines to the system.
And urine acidity. That plays a role too.
It does. Persistently acidic urine, say with a pH below 7.0, is a risk factor because uric acid is just less soluble, less likely to stay dissolved in acidic conditions.
So it prefers to crystallize out.
And concentrated urine doesn't help either. Higher concentration makes crystal formation easier, plus maybe a lack of natural substances that normally inhibit crystal growth.
Okay, so summing up the formation factors, you absolutely need high uric acid in the urine, that hyperuricemia. Then acidic urine, concentrated urine, maybe increased ammonium with liver shunts. It all creates the perfect storm.
You got it. That's the recipe for urate stones.
So now let's shift to what this actually looks like for the pet owner. What are the signs?
Well, here's an interesting point the sources highlight. A lot of these stones, especially if they're small and just kind of hanging out in the bladder, might cause no signs at all.
Really? Asymptomatic?
Yeah, they can be incidental findings. The vet does an ultrasound for some other reason, and hey, there's a stone.
But when they do cause symptoms, what are we talking about?
Often it's those classic signs of lower urinary tract irritation, things like seeing blood in the urine hematuria.
Okay.
Or the pet needing to pee really often, but only passing small amounts. That's pollakiuria. Straining to urinate, that's stranguria. Maybe it looks painful when they pee, dysuria. Or having accidents inside. Basically signs that something's irritating the bladder or urethra.
And this brings up that critical question.
Oh.
What if a stone doesn't just irritate, but actually gets stuck?
That's the big worry. Urethral obstruction. If a stone, especially in a male dog, lodges in the urethra and blocks the flow of urine, that is a true emergency, life-threatening.
Why is it so immediately dangerous?
Because urine backs up, pressure builds in the kidneys, kidney damage can happen fast, and waste products the body normally gets rid of in urine build up to toxic levels very quickly.
Okay, so what are the signs of that blockage? What should people look for?
It's usually pretty dramatic and distressing. The dog is straining, maybe crying out, trying desperately to pee, but nothing or only tiny drips are coming out. They might seem painful in their belly, become very lethargic, maybe start vomiting.
So straining without producing urine, especially in a male dog, is a siren call. Get to the vet immediately.
Absolutely. No waiting. It's a 911 situation for pets.
The sources mention stones higher up, like in the kidneys or ureters, are less common.
Yes, and often asymptomatic unless they cause an obstruction higher up, which can lead to kidney problems.
And what if the stones are there because of that underlying liver issue, like a PSS? Would you see other signs too?
You might. You could see signs related to the liver dysfunction itself. Neurological signs are common with shunts, things like disorientation, acting spaced out, head pressing against walls, even seizures.
Wow.
Also, maybe digestive signs like vomiting or diarrhea, poor growth in a young animal, weight loss, sometimes even jaundice, that yellowing of the skin or eyes.
Okay, so we know what they are, the potential causes, the signs.
Yeah.
How do vets actually pinpoint urate stones as the culprit? Especially given what you said earlier.
Right, and this is where that key diagnostic challenge comes in. The really crucial thing to remember about urate urolithiasis is that they're typically radiolucent.
Radiolucent, meaning invisible on X-rays.
Pretty much. Unlike many common stones like struvite or calcium oxalate, which are dense and show up bright white on a standard X-ray, urate stones often have about the same radiographic density as soft tissues or urine, so they just don't appear.
Okay, so a vet takes a regular X-ray, sees nothing, but that doesn't rule out urate stones. That's a huge diagnostic pitfall.
It really is. You can't rely on plain X-rays alone to rule them out.
So how do they find them then? What's the process?
Well, it starts, like always, with a good history, asking about all those urinary signs. The diet, the breed is a big clue, of course, and a thorough physical exam looking for any signs suggesting liver disease.
Then, looking at the urine itself, urinalysis.
Definitely. Urinalysis is key. They'll check the pH with urate stones. It's often acidic, usually less than 7.0, and they'll spin down the urine and look at the sediment under the microscope.
Looking for crystals.
Exactly. Looking for urate crystals. They have a fairly characteristic appearance, often described as yellowish brown, maybe diamond-shaped, or like little whetstones.
Okay, so finding those crystals points towards urate stones.
It's suggestive, and here's another really important nuance. The sources stress finding urate crystals alone isn't definitive proof of stones.
Wait, why not, if you see the building blocks?
Because remember the Dalmatians, they all excrete high levels of uric acid due to that genetic quirk. So it's actually pretty common, even normal, to find urate crystals in a Dalmatian's urine, even if they don't have any stones and never formed them.
Ah, I see. So the crystals can be present just due to the high concentration without necessarily clumping into stones yet.
Precisely. So crystals are a clue, especially if there are urinary signs or other risk factors like breed, but you can't hang your hat on crystals alone to diagnose stones. And finding them without stones doesn't automatically mean you need to treat.
Got it. Crystals suggestive, not diagnostic of stones. What about blood tests?
Blood work is really important. Less for finding the stones themselves and more for assessing overall health and, crucially, checking liver function.
Looking for that underlying liver cause.
Exactly. Running tests like liver enzymes, albumin, BUN, maybe bile acids, these help screen for conditions like a PSS. Things like low albumin or unusually small red blood cells can be common indicators of a shunt.
What about blood uric acid levels? Would they be high?
Interestingly, usually not in the common genetic form like in Dalmatians. Remember, their issue is the kidneys excreting too much, not the liver overproducing it, so blood levels might be normal. However, if the cause is severe liver disease, then yes, blood uric acid might be elevated because the liver isn't processing it correctly.
So blood work helps piece together the why. But back to actually seeing the stones if x-rays are often useless. What imaging works?
Ultrasound. Ultrasound is really valuable here. It uses sound waves, not X-rays, so it can easily visualize radiolucent stones inside fluid-filled structures like the bladder. They show up as distinct objects.
And ultrasound can look at the liver too, right, for shunts?
Yes, it's excellent for evaluating liver size, texture, and blood vessels, potentially identifying a shunt.
So ultrasound is a go-to. Is anything else needed for a definitive view?
Sometimes, yes. For really clear confirmation, especially if ultrasound is ambiguous or you need to map things out precisely, contrast radiography is used.
Contrast radiography.
Right.
Like injecting dye.
Yeah, like a double contrast cystogram where they put some air and some special dye into the bladder. Radiolucent stones will then show up as filling defects, dark spots where the white dye isn't. Or even better, a CT scan.
CT scans.
CT is considered the most sensitive imaging method for detecting stones, including radiolucent ones. It gives a really detailed 3D view and is great for assessing for shunts, too.
Okay, so imaging is critical.
Yeah.
But the sources mention one step that's like the ultimate confirmation. Absolutely mandatory.
Yes. And what's really fascinating here is that urolith analysis is mandatory. You actually have to get a stone or pieces of one out of the pet somehow.
Retrieve a stone.
Retrieve it, yes. And send it to a specialized laboratory for quantitative mineral analysis. That's the only way to know for 100% certain that it's a U8 stone or a mixed stone containing urate.
And knowing the exact composition is that important.
It is absolutely critical because the long-term prevention strategy completely depends on knowing exactly what type of stone you're dealing with. You can't just guess based on breed or imaging or crystals. Analysis is king.
Analysis is king. Got it. And what about genetic testing?
Genetic testing is available, especially for breeds like Dalmatians and Bulldogs, to confirm if they have that SLC2A9 mutation. It confirms the underlying genetic cause, which is helpful, especially for breeding programs. But it doesn't replace stone analysis for confirming the type of stone the animal actually formed.
Right. Cause versus composition. And maybe specific liver function tests, or even a biopsy, if liver disease is really suspected.
Definitely. Bile acid tests, ammonia levels, potentially imaging, or even a liver biopsy might be needed to investigate an underlying liver cause thoroughly. It's all about building that complete picture. Find the stone, confirm its type, and figure out why it formed.
Okay, makes sense. So let's say we've done all that. We found a urate stone. We know its composition. Maybe we even know why it's there, how to get rid of it, and crucially, keep it from coming back.
Well, first things first, if the pet presents with that life-threatening urethral obstruction, that's job number one. Emergency stabilization, IV fluids, pain relief, and then relieving the blockage.
How do they do that?
Often they try urohydropropulsion, flushing the stone back up into the bladder where it's not causing an immediate blockage. If that doesn't work, sometimes emergency surgery, a urethrotomy, is needed to cut into the urethra and remove the stone.
Okay, that's the emergency. What about non-obstructive stones just sitting in the bladder?
For those, medical dissolution is often the preferred first approach, if it's feasible, meaning trying to dissolve the stones with diet and sometimes medication.
Dissolving them, how does that work?
Diet is absolutely crucial here. The sources are very clear.
Yeah.
Specific prescription diets low in purines are the cornerstone. They mention examples like Hill's prescription diet of bird or Royal Canin urinary UC low purine.
Low purine makes sense, less raw material.
Mm-hmm.
But how does the diet actually dissolve an existing stone?
It works in a few ways. Yes, reducing purine intake lowers uric acid production, but maybe even more importantly, these diets are specifically formulated to make the urine more alkaline.
Alkaline, so raising the pH.
Exactly. They aim for a urine pH typically above 7.0, often targeting 7.0 to 7.5. Remember how uric acid is less soluble in acidic urine? Making the urine alkaline makes uric acid more soluble. It encourages the stone matrix to literally dissolve back into the urine over time.
Like dissolving sugar in hot water versus cold. Alkalinity is the hot water for urate.
That's a great analogy. And third, these diets promote increased water intake and create more dilute urine, which also helps keep things dissolved and flush out crystals. Using the canned version of the food or adding water to the dry kibble is often recommended.
So the diet is actively working on the stone by changing the urine environment. That's key.
It's the foundation. And often, especially for dissolution, it's combined with a medication called allopurinol.
Allopurinol, what's its role?
Allopurinol works further up the chain. It's a xanthine oxidase inhibitor. Basically, it blocks one of the key enzymes involved in converting purine breakdown products into uric acid in the first place.
So it reduces the amount of uric acid being produced.
Precisely. This is really important for dogs with a genetic defect, like Dalmatians, or those with liver disease where there's just too much uric acid floating around.
Okay, so the diet changes the urine environment and allopurinol reduces the uric acid load. Sounds like a powerful combo. Anything tricky about using allopurinol?
Yes. There is one extremely important warning that comes up repeatedly in the sources. Allopurinol must be used together with a strict low purine diet.
Must. Why is that pairing so critical?
Because allopurinol blocks the final step to making uric acid. If you give allopurinol but the animal is still eating a diet high in purines, the body accumulates the precursors to uric acid, specifically a substance called xanthine.
Xanthine.
Yes, and xanthine itself is very poorly soluble in urine, so if it builds up because you're blocking its conversion to uric acid and feeding lots of purines, you can end up forming a different kind of stone, xanthine uroliths.
Whoa. So you could trade a urate stone problem for a potentially harder to manage xanthine stone problem if you don't use the right diet with allopurinol.
Exactly. It's a critical interaction. You absolutely need that low purine diet to prevent xanthine buildup when using allopurinol. Compliance with both is essential.
That is vital information for anyone whose pet is prescribed allopurinol. How long does dissolution take?
It takes time and patience, weeks to months typically. The average might be somewhere around 2 to 6 months, sometimes longer, and it requires regular monitoring, usually with ultrasound, to track if the stones are actually shrinking.
Okay. What if dissolution doesn't work or isn't an option? Maybe the stones are too big or they're causing persistent problems.
Then other removal methods are needed. For very small bladder stones, especially in female dogs, sometimes that urohydropropulsion technique can be used to flush them out non-surgically.
Okay.
But more commonly, surgery is the answer. A cystotomy, surgically opening the bladder to physically remove the stones, is often necessary for larger stones, multiple stones, or when dissolution fails or isn't appropriate.
And are there less invasive options becoming available?
Yes, minimally invasive techniques are out there, usually at specialty centers. Things like cystoscopy, using a small camera scope passed up the urethra into the bladder, combined with laser lithotripsy to break the stones into tiny fragments that can be flushed out, or using tiny baskets to retrieve small stones.
Right, more advanced options. And what if the underlying cause was identified as a portosystemic shunt?
If that's the case, surgically correcting the shunt, if the animal is a good candidate, can be curative. Fixing the underlying blood flow problem often resolves the metabolic issue causing the stones, preventing future formation.
So fixing the shunt can fix the stone problem too.
Often, yes. If surgery isn't possible, then it's long-term medical management of the liver disease with diet, medications like lactulose, and managing the stones as they arise.
Okay, so we've gotten rid of the current stones one way or another.
Yeah.
What's the long-term outlook? What's the prognosis?
Well, the immediate prognosis for resolving the acute signs by removing or dissolving the stones is generally good. The pet usually feels much better once the irritation or obstruction is gone.
I sense a but coming.
There is a significant but. The prognosis for recurrence is guarded without very strict, lifelong prevention strategies.
Guarded, meaning they often come back.
Yes. Urate stones have a high tendency to recur. The sources cite recurrence rates anywhere from 30 to 50% within just the first year if preventative measures aren't diligently followed.
Wow, 30 to 50% in a year. That's really high.
It is, and even with good management, especially in genetically predisposed breeds like Dalmatians, recurrence can still happen. Lifelong prevention isn't just recommended, it's basically essential.
And if the cause was liver disease, the prognosis for stones is tied to managing the liver.
Absolutely. If the underlying PSS or other liver condition isn't successfully treated or managed, the metabolic driver for stone formation is still there, making recurrence highly likely.
So prevention is key. What does that involve? Lifelong monitoring.
Monitoring is a huge part of it, absolutely crucial. And it starts, as we said, with getting that initial stone analyzed. Mandatory. Know your enemy.
Right, stone analysis first.
Then, after removal or dissolution, you need imaging to confirm all stones are truly gone, a clean slate. After that, regular follow-up is vital.
What kind of follow-up?
Regular urinalysis is key. Checking the urine pH, frequently owners can even do this at home with dipsticks to ensure it stays in that target alkaline range, 7.0 to 7.5. Also checking urine-specific gravity to make sure it's dilute, and looking for any returning crystals. Urine cultures are important, too, to catch any urinary tract infections early as they can complicate things.
How often for urinalysis?
Initially, maybe every 1 to 3 months, then potentially stretching to every 3 to 6 months lifelong, depending on the case.
And imaging, even if x-rays might miss them.
Regular imaging is still recommended. Ultrasound is often preferred because it reliably picks up radiolucent stones. The goal is to catch any new stones when they are very small and potentially easier to dissolve or manage medically before they cause big problems.
How often for imaging checks?
Again, maybe more frequently at first, say every 3 to 6 months, then potentially every 6 to 12 months lifelong.
Okay. Anything else in the monitoring plan?
Periodic blood work is wise, especially to monitor liver function if that was the underlying concern. And of course, continuing the preventative diet is non-negotiable. Sometimes lifelong allopurinol is needed too, always with the low purine diet.
And using those genetic test results for breeding advice is important too.
Yes, for responsible breeding in predisposed lines.
So pulling it all together, based on these sources, what are the absolute must-know takeaways for someone whose pet has been diagnosed with urate stones?
Okay, key points. First, really try to understand the specific cause in your pet. Is it the genetic predisposition, like in a Dalmatian remembering all have the gene, but not all stone? Or is it secondary to liver disease? Knowing the why guides everything.
Right, and know that these stones can often be medically dissolved, but it requires serious commitment, strict adherence to that special diet and any medications. No cheating.
Absolutely. And hammer home that prevention is a lifelong journey. You have to accept that and be prepared for it. That high recurrence rate, 30–50% in the first year without management, is real. Letting prevention slide is asking for trouble.
And that huge warning sign about allopurinol. It must be given with the low purine diet to avoid causing those other nasty xanthine stones.
Yes, critical point. Also, empower owners. They can actively participate by monitoring urine pH at home. Keeping it in that alkaline 7.5 range is a concrete goal.
And the emergency alert. Straining to pee with no urine coming out, especially in a male dog, means go to the vet now, don't wait.
Definitely. Also, be realistic about the potential costs involved. Diagnosis, maybe surgery, the prescription food for life, regular monitoring, it adds up.
And finally, understanding the value of genetic testing for breeding and knowing when to ask for a referral to a veterinary specialist if the case is complex.
That covers the essentials, I think. It really emphasizes that it's not just about getting rid of the stone you see today.
Yeah, it's definitely not a one-and-done fix. It's about managing an underlying condition long-term based on why it happened in the first place.
Exactly right. The stone is often just the tip of the iceberg, the visible sign of a deeper metabolic or genetic process.
Okay, so let's try and summarize the core learning from this deep dive. Urate stones in dogs and cats, they're tricky because they're often radiolucent, invisible on standard x-rays. Diagnosis needs things like ultrasound or contrast studies, and getting the stone analyzed is absolutely mandatory.
And they form because of either a specific genetic defect affecting how the kidneys handle uric acid, think Dalmatians, or due to underlying liver disease, like a portosystemic shunt, messing with metabolism.
Management hinges on special prescription, low-purine diets that make the urine alkaline and dilute. Often, medication like allopurinol is added, but only with that low-purine diet to prevent xanthine stones.
And because they love to come back, lifelong prevention through diet, careful monitoring of urine pH, and for new stones with imaging, and managing any underlying liver disease is absolutely essential. Recurrence is common otherwise.
It really underscores the importance of personalized medicine, even in pets. So, here's a final thought for you, our listener, to chew on. Knowing why a specific pet formed a urate stone, whether it's deeply embedded in their breed's genetics or a consequence of a metabolic problem like liver disease, fundamentally changes the entire approach to diagnosis and lifelong management. It's never just about the stone itself. It's about understanding the whole physiological story to prevent the next chapter. What other common health problems in our pets might, similarly, be just the surface manifestation of a much deeper, hidden metabolic narrative unfolding inside them?
That's a great question to ponder. It highlights how interconnected everything is within the body.
It really does. Thank you so much for joining us for this deep dive into canine and feline urate urolithiasis.